had an acute injury of the soft tissues around that's caused caused you hip pain or a hip strain or a hip sprain, so to speak. Those injuries heal with time, with rest and medicine and activity modification. But hip arthritis builds over time. If you think of it like the tread on a car, the cartilage of the joint is like the tread on the car. With more mileage that's put on that, the tread falls off of that tire, and we don't have a good way to kind of put that cartilage back on. So once the tire gets bald, so to speak, you have to replace it. Patients often ask me, what can I do to delay the onset of hip arthritis? The three main things I always emphasize are diet, weight loss, and exercise. So maintaining a healthy diet, maintaining a regular exercise regimen, specifically low impact aerobic exercises, and then obviously, as I mentioned with the knee joint itself, maintaining an ideal weight range. So let's say, your doctor's told you that you have a mild or a moderate amount of hip arthritis. What can you do to manage that? Just like with the knee, physical therapy, anti-inflammatory medicines such as Advil or Aleve, the stronger you make your muscles around the hip joint itself. And that is where physical therapy comes in. You can work with your therapist and also work with your doctor or physician about these elements and these modalities. But the stronger you get those muscles, the better the forces are distributed across your hip joint. So your hip will thank you for that. And so the next step after that is injections. And a lot of times this is done under fluoroscopic guidance. So you have to make sure that you get the needle right into the hip joint. A lot of times patients will come in and tell me, oh, I've already had a hip injection. It's important to know where that needle was because there are various different types of hip injections that you can get. Classically, severe hip arthritis is manifested as groin pain. So patients will come in and they point to pain radiating into their groin. They'll often draw it out for you. Now this can also be further confused and somewhat complicated by if a patient has back pain as well with a pinched nerve, so to speak. And what this will present as pain coming down around from the back to the buttock area and oftentimes radiating down to the feet or the toes. It's important to discuss with your doctor or your provider about which element of this is contributing to the pain, because it can be a very confusing picture, but we're here to help you with figuring out that process and what to do to treat and manage that. If you've already tried multiple rounds of physical therapy and strengthening your hip muscles, you've already tried multiple injections, you've had maybe injections of the back, injections in the hip, and you've also tried the medicine and things are no longer working, and you have that point where you're essentially at bone-on-bone hip arthritis, the answer for you is a total hip replacement. So just like with the knee replacement, with the hip replacement, the surgeon goes in and has to cut out the arthritic bone, that bone-on-bone that's rubbing together and causing pain in the hip joint, causing that debilitating groin pain for the patient. The surgeon has to go in and replace the femoral head and neck with a sophisticated artificial implant that recreates that ball and socket. So they have to go in and prepare the new socket for the hip joint and replace the femoral head and neck. So you recreate that ball and socket with an artificial component. So patients by and large report long-term very successful outcomes following a total hip replacement, especially in the appropriate indications. Now, if you look at the literature across the board, if you take everybody who got a total hip replacement and compare it to total knee replacements, total hips actually do better than total knees. So following your total hip replacement, if you end up getting admitted to the hospital, you'll be there for likely 1 day, but maybe sometimes 2 days or a little bit longer if it's necessary. You'll work with physical therapy. They'll get you up and moving. The same day of surgery, your pain will be well controlled. And the vast majority of patients go home afterwards and have a great quality of life reported beyond 15 to 20 to 25 years down the road. So here at Penn Highlands, we are experts in total hip replacement, and we're here to partner with you along the way. You've been suffering for years from debilitating hip arthritis, and we're here to do that replacement, be there with you in the recovery process, and get you back on the road, get you back to what you want to do on a day in, day out basis.